Okay, so today this is our video practical for general medicine. So my patient, who is Steve, say hi, Steve.
Hi, Steve.
He has history of seizures and had recently had another seizure and fell on his head during a volleyball match and has been experiencing some otorrhea, which is just bleeding from the ear, vomiting, and then shortness of breath and chest pain. So I'm going to perform a quick medical evaluation for Steve. So here I go. So I'm going to use my stethoscope for the cardio. So I'm going to find the points here. Got a good heartbeat. While you're doing this, you want their patient just to breathe in and out nice and slowly and relaxed. You're listening for that good heartbeat. Make sure the last one's down here in the apex. Alright, good. So, didn't find any difficulties or abnormalities. I'd say it's strong, pulsating heartbeat. So next thing I want to do is the respiratory sounds. I'm going to do those for both of his lungs. Since he has shortness of breath and chest pain, we want to kind of look at that. So kind of want to start up here. And you're just in through your mouth. There you go. You're just listening for any sort of wheezing, crackling. If you've got any sort of crackling, there might be some sort of lung problem. So I'm going to do those first two there, and then the next two in the same spot, just on the other side. Nice sounding lungs, that's for sure. Good. Okay, the next ones we're going to do it on his ribs, so I'm going to have him lift his arm up and get right in there. Just have nice. Good. Okay, again. Good. One more time. Good. Okay. Now we're going to go to the other side. In the same spot again. Just we'll make sure we get up in there. You're just listening for that nice in sound and out sound. Good. Nice and relaxed. Good. One more time. Good. Okay, now we're going to do it on the back as well. So, gotta have him move around. So just in. Good. Again. Good. Okay, and then go to the other side. Good. Okay. Good. Okay. All right. So respiratory sounds were good. We just wanted to make sure that there's no sort of lung problem with Steve. And then the next thing I want to do is check an abdominal inspection. So I'm going to have him lay down. For abdominal, you want to do inspection, then auscultation, then palpation and percussion. So I'm just going to inspect first and see if I can see any sort of abnormality. You kind of want to cut the stomach into 4 quadrants. So upper right, upper left, lower right. So just looking around to see if there's any sort of abnormality, anything that I can see, any cuts, anything. I don't really see much, so the next thing I'm going to do is auscultation. So I'm going to get my stethoscope again. And with the abdomen sounds, you just want to hear for that kind of gurgling, kind of stomach movement sound. That's what you're looking for in each quadrant. So again, we're going to split the quadrant from the belly button. So we're going to first go in the upper right. Okay. Hear that gurgling sound? And it's pretty faint in some regions, so just the smallest of a gurgle sound will suffice. There we go. And then again. Good. So if you don't hear that gurgling sound, you might think that there's some sort of gastrointestinal problem because you're not hearing that stomach churning, you're not hearing the lower intestines kind of moving. So next I'm just going to palpate. So kind of like to do it with the heel of my hand and just kind of roll into palpation like that in each quadrant. And I'm feeling for any sort of rigidity, kind of anything that doesn't feel right. You know, the guts kind of should feel nice and soft, but if I feel any sort of rigidity or if I do this and it hurts in that region, then I'm definitely going to inspect it a little bit more. And finally, I'm going to do percussion. So all you do for percussion is take your fingers and you just tap. And you're listening for certain organs. I know over here it's definitely going to be a little bit different, and it's different than bone. So you're just it's a little, I don't know if you could hear that, but that was a little more of a harder sound. And then up here when we get into the organs is definitely a good sound. Okay, so abdomen looked good, so let's have them sit up. The next thing, since we don't have an otoscope, this is my otoscope. I'm going to do an ear, nose, and throat kind of inspection. So since where there was bleeding from the ear, I want to have him scoot a little bit. I'm going to inspect his ear for sure to see if it's just a cut in the ear or if that tympanic membrane is kind of gone and we need. So obviously there would be a light shining in here. You kind of want to lift that ear up and then you would look into the ear. And right now, if I actually had an otoscope, I would be inspecting for any sort of cuts, built up earwax, anything, any kind of protrusion that would ultimately block his ear and cause bleeding. So I do it on this side as well. So I'm gonna have him just scoot over a little bit. There we go. Again, lift that earlobe up. You're looking inside. And you're inspecting, having him nice and relaxed. Okay. Same for the nose. So I'm gonna have him lean his head back a little bit, and you want to be on the outside, so you're not up in their face. So I'm just gonna look up into your nose. Good. Again. Good. Okay. So finally, just gonna check to see how his lymph nodes are in his throat. So palpate along his neck, see if there's any enlargement in there. He could have some sort of neck pain, any sort of neck pain, especially after seizures. So we definitely want to be careful here. And just palpate along down his throat, and even up into his cervical spine, back in the back, and see if there's any sort of pain. And if there's nothing there, then we can move on with our evaluation with finally the eye. So after his history of seizures, and he had a seizure, we definitely might be thinking of a possible sort of concussion if he hit and he's vomiting. So I'm going to do an eye inspection with my ophthalmoscope, again, my trusty spoon. So what we want to do for this is we want to have them actually kind of look at something, so they're kind of distracted. So I'm going to have Steve look up at that speaker. And again, I'm just going to be shining, and I'm going to be looking for pupil restriction, dilation, any sort of irregular eye activity movement, or any sort of cloudiness in there to see if there's any sort of damage to the eye. Again, looking up at that light. Good. So, didn't find anything there. And finally, one thing I do want to do is because that possible cranial nerve might have been damaged, I want to go through a cranial nerve assessment. So 1 through 12, we're going to do them all. So first I'm gonna have Steve test olfactory. So, what does this smell like?
Your thumb.
There you go. Okay. Second, the optic nerve. I want you to look over there at that little red square, and what does that say?
AED.
Perfect. Okay. So now, with my trusty pen light again, which will be my spoon, I'm gonna have him close his eyes, and then I'm gonna have him open them, and I'm gonna shine the light and track ocular motor, and then I'm gonna have him come in as well and see how his eyes are tracking the spoon. Good. And then go up. Test abducens and trigeminal. Good. And then we're going to go up and down. Good. And if there's any sort of damage to any of these cranial nerves, you would see maybe an irregular eye, not tracking. Next one would be facial. So I'm going to have you smile, frown. Yeah, well, that's a frown, okay? And I'm going to see, can you feel this?
Mm-hmm.
Good, okay. I'm going to have you open your jaw. Don't let me close it. Good, okay. And then I want you to close your eyes again. We're going to test vestibulocochlear. So can you hear that?
Mm-hmm.
Which side?
Right. Left.
Good, okay. I'm going to have you stand up. And now we're going to be pretty cautious, especially after, you know, the whole seizures. You don't know how well their balance is, but I'm going to test the balance. So I'm going to have you hold your arms out to your, there you go. And then I'm going to have you on one foot. Good, and then switch. Good. So there's not so much of dipping and off balance, so we can say that that cranial nerve is good. So let's hop back up there again. Final two, or spinal test here, I want you to shrug your shoulders. Don't let me push them down. Good. Okay, and I want you to open your mouth and say, ah.
Ah.
Good. And swallow for me. Good. So, went through all those cranial nerves and decided that they're all intact and they're all good. So, I do want to say with my patient's history of that he did have a seizure and he was vomiting, he had shortness of breath and chest pain, that I would probably just refer them to the EMS and call 911 and get them to the hospital immediately. So, with that being said, there's my assessment.